Hi, I'm Dr. Ashish Davalbhakta at Advanced Aesthetics and Aesthetics Med Spa in Pune. In today's educational topic, we are going to cover the myths about blepharoplasty. Let's assume that you have decided that you would like to go for a blepharoplasty and you are researching all the information that is out there on the web about blepharoplasty. Let me tell you that there are some misconceptions or myths about blepharoplasty that if you listen to this video, it would help clear those misconceptions. Number one, that first is that you know that blepharoplasty is a procedure where we work on the eyelid skin, both the upper and lower eyelid skin. And it's a procedure which is meant to tighten the upper and lower eyelid skin. It's meant to tuck the skin and get rid of the wrinkles or the folds that one develops as one ages around the eyelids, and it's a procedure meant for rejuvenation. Let's assume that you have already consulted somebody and you're thinking about having a blepharoplasty. One thing that you have to keep in mind, a myth, is that a blepharoplasty can change the shape of your eye. So that's a myth number one, that doesn't happen. You cannot change the shape of the eye. The way the eyelids are, they eventually, after the swelling has settled, they go back to the way your eyes were. So if you're expecting that the eyes would become bigger, then that is not possible till you actually work on maybe the ptosis correction or the levator muscle, which helps in lifting the eyelid. But a standard blepharoplasty, both the upper and lower eyelid blepharoplasty, will not change the shape of your eye. There are some women who want to have an almond-shaped eye and all, then they will have to go for ancillary and other procedures, which can be done in conjunction with a blepharoplasty. But per se, blepharoplasty will not change the shape of the eye. You will, of course, have a healing period where your eye may look tight, may look a little pulled laterally, but that's only because of the swelling. Until the swelling settles, which takes anywhere between 6 weeks to 3 months, you may have that, but then it settles down properly. Another common myth or misconception is that you can do a blepharoplasty and immediately go to a party or you can socialize. That's not that easy, because it's a surgical procedure. The moment you have made a cut in your eyelid skin, there's so much of swelling and edema that sets in that almost for 2 to 3 weeks you may see that there's a fair amount of swelling around your eyes. If there are stitches put, the stitches will be there for around 7 days time, and then often people can get bruising, and the bruise may take 2 to 3 weeks to disappear on its own. So blepharoplasty is a fairly involved surgical procedure, done very skillfully and very finely, and the results are really appreciable and good, but you should keep time aside. Don't be under the pressure, unnecessary pressure of having commitments which you can't meet because the swelling hasn't resolved in time. So give yourself at least 6 weeks, 4 to 6 weeks for recovery. So it's not a procedure that you can do quickly. That's a myth. Apart from that, you would find that blepharoplasty is a fairly satisfying procedure, and if you do want to have the eyelid shape changed, like those who are talking about the cat eye and other things now that's gaining kind of popularity in the West, blepharoplasty is not a procedure that would do that. You would need to go a little bit beyond or further out from the standard blepharoplasty procedure to get a cat eye shape if you want. Do talk to your consultant, and he will help you in educating you about these common myths and perceptions. Another misconception or myth is that once you've had a blepharoplasty, then your skin around the eyes would stay young forever and it won't change. So that's a myth. That obviously is not going to happen, because with time you will find that the aging process hits those tissues. Of course, you would have moved back by 4 to 8 years in the aging in that area, and you would look younger to your peers because of these procedures, but aging never stops. So going forward, over time, you will still find that there are aging changes, and a myth that once you've done a blepharoplasty, you wouldn't need any skincare, ancillary treatment. That is also not true. So you would need to have the proper skincare, which means the vitamin C serums or vitamin A, retinol serums, all those things you would have to use to keep the skin turgor and hydration properly. And another myth is that once you've done blepharoplasty, the dark circles will disappear. So again, that is a myth that may not hold. You can't get rid of the dark circles by blepharoplasty if the dark circles are fairly wide or fairly large. If there's only a little streak of darkness or black under the skin, and the skin that we take out when we're doing a blepharoplasty, if the darkness or dark circles disappear in that, then you will get an improvement. But if you have got a fairly wide zone of pigmentation, then that's not going to go. So that's a myth. So take note of all of these things, and it will help you to make up your mind of whether you want to go in for a blepharoplasty. Thank you very much.